An emulsifier is basically a substance that will essentially keep things mixed together, where chemically there are liquids or other chemicals that want to separate.
Like water and oil.
Exactly. Great example. Think of a salad dressing. A natural salad dressing with no emulsifiers. You shake, 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 and you may try to pour it. As soon as you stop shaking and leave it on the counter, the water and the oils, so the water-based liquid and the oils split, and you have like it looks like, we see this on peanut butter or natural nut butters, right? All the nuts and the thick is down below and the oils right on top. So we see that split. An emulsifier helps to keep that cohesive and together. Now there is quite the spectrum of emulsifiers, and there's definitely some that are a little bit, what I would say, better than others, let's say, or a little less harmful than others. Where this comes, or any other context, is that, let us know, guys. Does that make sense? Hopefully that does. But
so in some studies, emulsifiers have been shown to decrease the diversity in the gut microbiome, because just like they can bind water to fats, they also can bind to certain microbes. So they can bind to some of the healthy commensal microbes that keep our beautiful protective layer of mucus really healthy. Not all of them, though. So if you are somebody who maybe has inflammatory bowel disease like Crohn's or ulcerative colitis, you probably want to avoid, yes, some of the more synthetic binders and more of the synthetic gums. What are those going to contain? So you're going to be avoiding things like carrageenan if it's synthetic. And I will say that because there's actually natural carrageenan that's found in algae. And this is not going to have the same binding capacity as an artificial allergenin, which is an artificial form of carrageenan, or highly processed synthetic carrageenan. So if you're ever wondering, I always encourage my patients to do this all the time. Call the company and ask them what they're sourcing. Is it natural or is it synthetic? They should be able to tell you that. So you can ask, can I see a certificate of analysis, or where are you getting these things? You also probably want to avoid, if you have ulcerative colitis or you're concerned about that with gums, things like polysorbates, propylene glycol, polyglycerols. Certain gums outside of things like partially hydrolyzed guar gum, which is a type of gum that just comes from sunflower seeds themselves, but altered pectin. Again, this is a synthetic form of pectin, which is a type of fiber that's found in the skin and the pulp of fruits like apples. Apples are a great source of pectin, but if it's altered, again, sometimes that has overzealous function and it can overbind some of your microbes. Altered cellulose, another type of fiber that is in the skin and the pulp of different vegetables and plants. So those are ones that are probably a little bit less safe. But let's talk about which ones are better. So I mentioned partially hydrolyzed guar gum, natural pectins, and natural cellulose. Those are probably a little bit more safe. Natural carrageenan found from algae, and then lecithin. So again, lecithin is a type of nutrient. It contains phosphatidylcholine. So it's a type of fat that's naturally found in certain plants. So it's found not only in plants like soy and sunflower and their oils, it's also found in eggs. So eggs are also a source of phosphatidylcholine, which contains lecithin. So to answer that question with gums, we talked about which ones are safer and which ones could be better options for those with inflammatory bowel disease.